Hello everyone. I welcome you all to this uh, interesting live. Uh, this is the, I guess, Allen's keynote, Bogus keynote key organ at the fourth. We have started this fourth series. Sorry, I know I forgot because of this long break. But this long break was definitely one of the most awaited one because I had few more things that I had to do, and soon I'll be sharing with you all that uh, very interesting guest tonight. This is the second session of Materia Medica marathon for clinical organ, clinical marathon, and topic which today is a very interesting topic, which is ophthalmology. So ophthalmology is one of the most, I think that ophthalmology, dentistry, the most underrated ones. So I was waiting for this to happen. Uh, we have our guest today who is going to enlighten us is Dr. Kazi Muhammad Salim sir. Kazi Muhammad Salim sir is attached to oldest homeopathic medical college of India, that is Calcutta Homoeopathic Medical College, and he looks after the ophthalmology OPD. He's try ओके मारूफ सर अगर ज्वाइन नहीं कर पा रहे, सर का लैपटॉप नहीं है ना, लैपटॉप से नहीं होगा सर का, इसमें आ रहा है कि अनेबल टू ज्वाइन. So again, sir is a very senior fellow, and because again he was also not there on Instagram, we requested him, sir, please, there are a lot of students who wish to learn what you're doing, and it's a, I'll just send an invitation again. सर वापस इनविटेशन आपके स्क्रीन, मारूफ सर के स्क्रीन पे वापस इनविटेशन आया होगा तो यस, हाँ वो सामने एक सर्कल वाला बटन है, दो, यस यस यस.
Hello.
Sir, good morning, sir, and thank you so much for coming, sir.
Good morning, everybody.
Good morning, sir. There are a lot of students waiting to learn from you. There are a lot of students who are really very eager that they will get to learn so many things from you. Sir, I'm really happy that you agreed to come.
Thank you. Thank you.
Sir, before you came, I was just giving a short introduction about you, that you have been attached to the oldest homeopathic medical college of India, that is Calcutta Homoeopathic Medical College, and sir's OPD has approximately 90 to 100 patients of general and eye complaints. So sir's forte is in ophthalmology, and sir's forte, and he has been doing this for, I guess, sir, 27 years ho gaya, sir? How many years?
Yes, 27 years experience.
Yes, sir. Since 27 years, sir has been practicing and has developed this extremely. Sir, not many people we know in homeopathy are doing homeopathic ophthalmology. So how did you come up with this? Sir, you wanted to excel in ophthalmology branch.
Yes, actually, first I passing the BHMS examination after completion my course. Then I am interested about this ophthalmology because our teacher, the physiology head HOD, Dr. T.K. Basu, is actually coming from MBBS and eye specialist. But he also a good teacher in our homeopathy system, and he also practiced the eye with homeopathic medicine. So it is the encouraging point for me. One of the MBBS teacher practicing homeopathy in eye diseases. So why not I cannot practice in homeopathy in case of eye diseases, as I am a BHMS. So next I take a qualification, that is the diploma in ophthalmology from a institution, and we merge the knowledge the homeopathy and the ophthalmic knowledge both are combined, and we practicing homeopathy gradually. Then we another training from Institute of Ocular Science, another training from the another eye institution. By this way, I gathered some knowledge about the ophthalmology, and we reading the Mitra Medica, and we as a teacher of the Mitra Medica in the Birbhum Vivekananda Homoeopathic Medical College. When we teach the Mitra Medica, when the teaching the students, we gather the knowledge about the eye disease is easily controlled by homeopathy. Though some limitation is there, but we can practice in homeopathy in eye diseases in particular part. And gradually in 2023, we joined as a surgery teacher in the department of the eye at Calcutta Homoeopathic Medical College, and we teach the students about the eye diseases, and we practicing in OPD and in myself chamber. The patient comes in different diseases, easily controlled by homeopathic medicine without in the support of the allopathic system of medicine. And very peculiar is there, some patient comes in my OPD, they are not cured by allopathy system of medicine. Say for example, patients suffering from glaucoma, patients suffering from stroke of the eyes, patients suffering from CSR, that is edema of the macular edema. These are some critical cases which is easily controlled by homeopathy system of medicine, and they are generally failed by the allopathic system of medicine. And gradually we increasing my knowledge by practicing and practicing.
Sir, I'm so, sir, whatever you said, we are all so excited that as a junior homeopaths, as a beginners, we are just limited to treating few things we know. And of course, all the drugs in Materia Medica have the section of eye, but we always happen to overlook it, or maybe we take it as an concomitant in few things. But we never have specialized in all these things. So we are happy that we will get to learn so many therapeutic indications, and we will see what is the exact scope, what all cases we can really accept, and how to examine those cases, sir.
Yes. When a patient comes to our chamber, patient complains, doctor, I cannot see clearly. I'm difficult of vision. So first of all, we identify the cases. What is the problem actually vision? As it is the case of refractive error. Very important point of the refractive error. Most of the people suffering from very early age to old age, they are suffering from refractive error. So it is not a case of medicinal, but it is simply controlled by refraction. Simply controlled by either it is myopic, he requires some minus glass. Suffering from hypermetropy requires so plus glass, and suffering from astigmatism, it is prescribed for minus or plus combined glass. Whatever we like this, patient suffering from refractive error, myopia, hypermetropia or astigmatism, it is simply controlled by refraction. Refraction is the part of the practice, but some patients suffering from progressive myopia, some patients suffering from progressive hypermetropia, some patients suffering from the corneal disorder, some patients suffering from optic nerve disorder, some patients suffering from macular disorder, and patients suffering from like as the cataract, very common complication. So like this complication, patients suffering from loss of vision gradually. Sometimes patient comes to a chamber, sudden loss of vision. Sudden loss of vision, it has two classes. Sudden loss of vision with pain and sudden loss of vision without pain. So sudden loss of vision with pain, then we suspect the case may be that is the retinal detachment. Severe pain is there with sudden loss of vision. One morning patient comes to a chamber, I have nothing to see from that time. What happened? So then it is indicated maybe it is the retinal detachment. And patient sometimes comes to a chamber, the pain is start from 2 days and the vision is lost. It may be case of the glaucoma, and no pain but gradually loss of vision, suspected case of the cataract. No pain but gradually loss of vision, suspected case of, that is the case of cataract. Sometimes patients suffering from inflammatory disease, severe conjunctivitis, keratitis, iritis, iridocyclitis, these type of complication may be present. Now, so we classify the cases. First time, it is as it is the disease of the anterior part of the eyeball or posterior part of the eyeball. Simple, with my torch, we examine the cases in the anterior part of the eyeball, that is the lids, conjunctiva, cornea, iris, and lens. Up to the lens, it is the anterior part. So it is easily we examine by a simple torch light. Any inflammatory condition, as it is a conjunctivitis, or any lid inflammation like as blepharitis or stye or chalazion, or any foreign body of the cornea. Sometimes patient comes to a chamber with foreign body, any dust particle, iron particle, or paddy seed in the very farmer, they are suffering from paddy seed inside of the eyes. So they comes to our chamber with this foreign body, and patients suffering from loss of vision, lacrimation, redness, congestion, these are the common symptoms is there, and loss of vision, patient difficult vision. Then we first select the cases, either it is the disease condition of the anterior part of the eyes by simple or torchlight. If there is no inflammation, no foreign body, and no other acute condition of the eye in the anterior part, but patient suffering from loss of vision, then we examine the posterior part of the eyeball. So posterior part examination depend on ophthalmoscopic examination. Posterior part examination depend on ophthalmoscopic examination. And such ophthalmoscopic examination, we look the case of the vitreous or retina or macula. And at the retinal part, there is some different part is there. In retina, first part is the optic disc. The root of the optic nerve, optic disc, is there is clear or pale color or dilatation or any hemorrhagic condition. Second, we observe the macular part. So macular part, it is also any congestion is there, any edematous condition is there, or pale color is there, choroid is observed by through the macula. This type of observation by ophthalmoscopic examination. Nowadays, another instrument is in our hand, though it is not available in our OPD, that is the slit lamp examination. Slit lamp examination also helpful to examination of the lens and posterior part, and direct ophthalmoscope is another instrument. It is also helpful to examination the posterior part of the eyeball. Sometimes we depend some investigation for the posterior part of the eyeball, like this USG of the any other part of the body, same USG on the eyes.
Yes.
DFA is the another term, that is the fundus fluorescein angiography. DFA, it is type of angiography of the eyes. So DFA and OCT is another examination of the macular part, any edematous condition is there or not. Tomography, OCT is the tomography of the eyes. And sometimes we examine externally the pressure of the eye. So like is the systemic pressure of our body, systolic and diastolic, it is the separate part of our body, but our pressure of the eyeball, that is the IOP, intraocular pressure, it is also a part of the important part for the eye diseases. This IOP we observe by an instrument, that is the tonometer. By tonometry, externally we place in the eyeball and a graphic picture is there, and by this way we calculate is the pressure is normal or not. Normal IOP is 16 average, 13 to 20 is the range of the IOP. But in Indian system of climate, if IOP cross 18, it is clinical. It is clinical. So average 17.3 is the average IOP, which is denoted by tonometry. When IOP increases, is suspected case of the glaucoma. More than 18, 20, 22, 23, then vision gradually comes down. Vision gradually comes down. Patient suffering from headache, patient suffering from lacrimation, discomfort, patient cannot go more on outside work. So patient suffering from pain in the eyeball, gradually loss of the vision, then comes to your chamber. Doctor, I am suffering some pain and I loss of my vision. First work, the visual acuity is noted. Visual acuity, we noted the patient actually what is the condition of vision of the patient at that point. It is called visual acuity. So visual acuity, sometimes patient wearing the glasses, so we noted the visual acuity with spec, sometimes patient without spec, so we noted the vision without spec. And separately, right eye, left eye separately. When we recorded the vision, either it is normal or not. Normal vision, that is the 6/6. So this is calculated by a fixed distance, that is the 6 meter. Patient table and vision chart. The distance is a 6 meter. It is a fixed. Dr. Snell's calculate the visual acuity. So it is called Snell's chart. By this fixed distance, from 6 meter distance, we denote the vision from the Snell's chart from above to downward. First letter is a 60, second letter is the 36 dimension, third letter is 24 dimension, fourth line is the 18 dimension, next is the 12 dimension, next is the 9 dimension, next last one is the 6 dimension. So anyone can read the visual chart from above to down up to the 6 dimension, so vision is normal, 6/6. If any patient cannot read up to the 6, below the 6, that is the 6/12, 6/18, 6/24, it is the less than normal vision. So when patient suffering from less than normal vision, maybe it is the refractive error, so we corrected by refraction. Otherwise, any internal disorder, like as a glaucoma, like as a macular edema, like as a optic nerve neuritis, or patient suffering from stroke of the eye, another important stroke of the eyeball. So stroke means that is the internal hemorrhage, either BRVO, branch of retinal venous occlusion, or CRVO, central retinal venous occlusion. Sometimes central retinal arterial occlusion may be formed. So on that time, a hemorrhagic condition is formed on the field of macula or any other part of the retina. So such stroke is the very, very acute condition of the eyes. The vision is suddenly fall. The vision is suddenly fall. Retinal detachment. Retina is attached with the choroid anatomically. There is no gap. And if the choroid and retina is separate, then a gap is formed and hemorrhagic condition is developed. The vision is fall. And sometimes macular edema, edematous condition. The exudative fluid accumulated inside of the macula. So macula is the mirror of our eyes. All object is formed on the macula, and we can see the object by the image of the macula. If such macula is damaged by water accumulation, by paleness, that is the loss of circulation, or sometimes any scar formation of the macula, or any opening, that is called hole of the macula, then our vision is disturbed. Then our vision is disturbed. It is the totally macular part of the eyes. Another part, that is the cataract, that is the opacity of the lens, our vision gradually lost. Glaucoma, IOP is increased, our vision is gradually lost. And vitreous opacity, our vision is gradually lost. Now corneal damage, most external part of the eyeball, that is the cornea, transparent avascular tissue. specialized tissue is there. And most important part of the eye, that is a four layer. That is a cornea, aqueous, vitreous, and retina. That is the four refractive media of the eyes. That is a cornea, aqueous, lens, and vitreous. Then here it is the retina. Retina is the most imaging part of the eyes. So any obstruction of the cornea, any obstruction of the aqueous, any obstruction of the lens, any obstruction of the vitreous, we can not see clearly. So cornea must be clear and transparent. Aqueous must be proper amount. Lens must be transparent. Vitreous must be transparent for vision. So any condition is developed, that is the alteration of the normal, alteration of the physiology of our eyeball. Either it is cornea or aqueous or lens or vitreous or macula, that is the retina, or optic nerve, that is the main point. So we cannot see clearly. The difficulty of vision is developed. Difficulty of vision is developed. So this is the disease condition. Either it is the anterior part of the eyeball or is the posterior part of the eyeball. It is a clearly condition. Now we classify the disease according to pathology. It is an inflammatory disease, or it is the neoplastic disorder, or it is a chronic inflammatory condition, or it is a degenerative process of the eyeball. Any lens cataract is a
vascular condition.
Vascular condition. That lens is the opacity of the lens. That means cataract is a degenerative process. So opacity of the lens is a degenerative process. Now, the cornea is inflamed. Very primarily, it is called keratitis. When such condition is progressed, untreated, then deep layer of the cornea is affected. So then it is called a corneal ulceration.
Sir,
because cornea is a
keratitis. Sir, what are the most possible good remedies that one should look for?
Yes, keratitis. Cornea has 5 layers. Most external part is the simple epithelial lining membrane, and second layer is the Bowman's layer. Third is the substantia propria layer. Fourth is the decimate membrane, and fifth one, most inner part, is the endothelial layer. If this superficial layer of the cornea, that is the epithelial layer, is damaged by any injury, punch injury, laceration, any blow, the corneal tissue, superficial tissue is hampered or damaged, then inflammation starts. It is called keratitis. It is called keratitis. So according to cause, now puncture wound is there. So Lidampal is the very important medicine. Now blow is there. Symphytum arnica is the good medicine. Now some ulceration, some pus formation, very sensitive. So then Hipersal is another medicine. And if such condition is run more than 7 days, then we suspect maybe developed ulceration. Then we prescribe Hipersal followed by Silesia. Sometimes Cifilinum is required. So this type of medicine is cured by the superficial keratitis. Otherwise, it is untreated or more than 2 weeks, then ulceration is developed. Deep layer, Bowman's layer is affected. Substantial layer is affected. It is very dangerous because this corneal ulceration, generally, our homeopathic philosophy, syphilitic ulcer. According to our homeopathic philosophy, this corneal ulcer generally developed, it is a syphilitic ulcer. If the ulceration is progressed, we prescribe antisyphilitic medicine. There is then this superficial medicine like as Belladonna, Astrax, or Hipersal is not indicated, because when it is progressing, ulceration is progressing, very important 3 medicine in my practice, 3 important medicine is helpful for control the cases. That is the Kali iode, Kali bi, and Mark Sol. Kali iode, Kali bi, and Mark Sol. So 3 important antisyphilitic medicine is helpful for control the corneal ulceration. In my practice in our OPD, a case that is the prolonged corneal ulceration suffering for 2 years, it is uncontrolled by allopathy system, and they take a diagnosis to remove the eyeball. So pain and swelling, lacrimation, and total cornea become opaque. Then a medical board makes a diagnosis that it is not cured, so the eyeball should be removed. Then patient comes in our Calcutta Homoeopathy outdoor with local symptoms of the eyeball. One hand, in our homeopathy, that is the totality of the symptom. But local symptoms and its modality is the most important in case of eye practice. It is my experience. The local symptom, patient suffering from congestion, pain, lacrimation. So this is the common symptom of the disease. But the most deeply, the discharge is very watery. The discharge is sticky, excoriating, sticky, watery discharge. So it is the case of calioid. Excoriating discharge is the calioid. If the discharge is thick, the discharge becoming thick, ropey in nature, so it is indicated calibi. Now the discharge is the excoriating, very much painful, and patient cannot tolerate either hot or cold. Patient cannot tolerate either hot and cold, so it is the case of Marksall. It is the case of Marksall. And generally all syphilitic are aggravation at night. It is the syphilitic common symptom in homeopathic medica. So according to local symptom, calioid control these cases. After all, the patient is safe. After all, the patient is safe. But the opacity of the cornea, when the opacity of the cornea is there, it is not cured by this type of medicine. Then we prescribe, when ulceration is controlled, to remove, or to some extent we can get relief to the patient by another medicine, that is Silesia, Calcarea floor, and zinc sulf. Very good medicine to remove the corneal opacity. But corneal opacity, though it is the scar tissue formation, it is not never totally cured, but to some extent it is controlled, and patient can see to some extent, not 100%, but to some extent patient can see. So it is the most important part. When allopathy system cannot do anything, we can do something. We can do something. So it is the important part for the patient as well as our pathy. This is the corneal ulcer, most important part. And next হচ্ছে আমরা একটু গ্লোকোমা ডিসকাস করি. গ্লোকোমা is a very common disease, and glaucoma one of the important point for blindness in our Indian climate. In our Indian climate, so many patients suffering from cataract and glaucoma. So cataract easily it is removed. It is easily removed by surgery, and artificial lens IOL implantation, and patient gets relief. But glaucoma, the allopathy system medicine, by drop to control the IOP, intraocular pressure, some drop is there, allopathy system, and sometimes they can take surgical help. That is the tab operation, trabeculectomy. Tab operation, that is the trabeculectomy. But after trabeculectomy, the pressure of the eyeball is not 100% controlled. Not controlled. So 2 years, 3 years, 4 years, 6 years, patient suffering from IOP increases and use the drop, and vision gradually lost. This is the important point. Glaucoma has different staging. First thing, it is acute or chronic. Then in acute case,
if you can,
acute congestive
at every stage, if you can just, while describing the stages of glaucoma, if you can also tell us what are the remedies at every stage, that will be very helpful.
Yes. Now glaucoma, in case of glaucoma, when patient comes to your chamber in acute situation, severe pain, swelling, redness is there, and vision is gradually lost. So gradually loss of vision is a very common symptom of all glaucoma patient. Now patient comes to a chamber suffering from glaucoma on the left eye. Someone says glaucoma on the right eye. Someone says glaucoma in both eyes. Now in acute situation, when patient comes to a chamber, very acute severe condition, first we try to relieve the patient of the acuteness, that is the pain, congestion and swelling, lacrimation, photophobia. These acute symptoms should be controlled by acute medicine like as belladonna. If patient suffering from both eyes, if patient suffering from right side of the eye, then sanguinaria canadensis is mostly indicated. If patient suffering from left eye, that is the spigelia is the most indicated. And onosmodium is another medicine. In case of left, onosmodium. So onosmodium, spigelia, sanguinaria, belladonna, this medicine is for acute control. And they are easily controlled by acute. After that, patient comes to a chamber after 7 days. Doctor, the pain is really, lacrimation is really, congestion is slightly there, but my vision is lost. It is the chief complaint of the patient. My vision is gradually lost. Then we prescribe another important medicine, that is then we depend according to the constitution of the patient. If constitutionally patient indicated phosphorus, then phosphorus is a good medicine to control the IOP in chronic cases. Another important medicine, either acute or chronic, patient suffering from long time for IOP increasing, then physostigma. Physostigma is another important medicine to control the IOP. Crocus sativa is another important medicine to control the IOP. In our clinical trial in Calcutta Homoeopathic Medical College, we trial the 15 cases. Clinically, only physostigma 6. Physostigma 6 potency. And someone indicated 30 and 200. But everyone with first prescription is the physostigma 6. And magically control most of them. After more than 70% patient controlled by physostigma 6. Someone is required physostigma 30, someone followed by phosphorus. But physostigma is very much indicated medicine for primarily control the glaucoma. And chronically phosphorus is another important medicine for glaucoma. Physostigma and glaucoma, I advise everybody, you trial the glaucoma patient, first physostigma 6, 30, 200. Otherwise, followed by physostigma, phosphorus is indicated in case of chronic stage. And in case of acute stage, they are belladonna, sanguinaria, onosmodium, spigelia is easily controlled. Okay, so glaucoma is the most important point, our system. Patients suffering from diseases, the increasing of the IOP and gradually loss of vision. Okay. And cataract, in case of immature cataract, when patients suffering from mature cataract, it is always prescribed for surgery. Mature cataract never cured, because cataract is a degenerative process. So there is some permanent damage. But in early stage or immature stage, if we control by our homeopathic system of medicine, then patient safe for surgery. Most of the patient in our outdoor, in our cell practice, in early stage of the cataract, we control by calcarea floor. First one is the 6x, then 12x, then 200. 6x, 12x, then 200 potency. In case of immature cataract, not mature cataract. Mature cataract always surgery. Mature cataract always advise surgery. Now, how you know it is a case of mature or immature? Very important point. Very simple. One point is there. If patient cannot see own hands from these 1 feet or 1 or 6 inch, patient cannot see his own hands. So it is definitely mature. It is not a diagnostic point. Diagnostic point, clinically, we observe the lens color, that is the whitish appearance, and depth of the anterior chamber of the eyeball, it is reduced, and visual reduced. PL-PR level is in assessment. PL means projection of light, PR means projection of ray, perception of ray. This assessment indicated it is a case of mature or immature. But simply we have no instrument, we have no knowledge, but we can assess the patient. You see your hands or no, and the color of the lens, white is apparent. So it is a case of mature. Go to surgery. I advise also in every homeopath. It is our old knowledge. Cataract is cured. Cataract is cured by homeopathy. Some author therapeutically written some books. Cataract is cured by homeopathy. But I advise to you, the mature cataract never cured by any medicine, either homeopathy or allopathy or ayurvedic. Mature cataract never cured by any medicine. But if it is the immature cataract, your medicine helpful to control the further progress. To control the further progress. So you prescribe the patient silesia, calcarea floor, calcarea curve, conium maculatum, if patient has immature stage. And in addition to some refractive correction by glass, and patient see clearly. And every year you observe the patient, your vision is normal or not. Patient says vision is normal. So go on next year. Gradually patient feels better. Last 5 years there is no required for surgery. But allopathy system is either immature or matured, all are surgery. But we all are surgery. Now we makes a division. That is, if it is the case of matured, so go to surgery. If it is the case of immature, so wait for homeopathy medicine. It is a good help for the patient.
So, next, according to your clinical experience, what are the clinical conditions which are where we have the highest success rate? Like what clinical conditions we should always accept and we will get always the success? And if you could also tell the remedies for that.
Immature cataract, glaucoma, and retinal hemorrhage, stroke of the eyes.
So what can we use for the stroke of the eye?
Stroke of the eyes, first prescription is the arnica. Stroke of the eyes, arnica 1 m, then 10 m. I control at least 10 cases by arnica, only arnica. And one case is, I remember, one case is required, followed by arnica, that is the Crotalus horridus. Crotalus horridus is the important anti-hemorrhagic drug for internal hemorrhage. So arnica and Crotalus, I say arnica and Crotalus is a good medicine for internal hemorrhage. Arnica is a good medicine, cerebral stroke also. But in stroke of the eyes, where BRVO, that is the branch of retinal venous occlusion, or CRVO, whatever may be, the hemorrhagic condition is formed at the macula or at the fundus of the eyeball. So it is controlled by arnica. Arnica 1 m, sometime followed by 10 m, and sometime if patient suffering some hemorrhagic point after 3 months, after 6 months, some hemorrhagic point is there, then Crotalus horridus is indicated. So Crotalus horridus is indicated. Okay. Now, please ask.
Sir, if I to ask about the external eye, there is one question from the student. She's asking, could you please elaborate on dacrocystitis and chalazion? If you could, because we even in our practice we have seen good success with dacrocystitis. But if you could tell us some remedies which really help in dacrocystitis?
Dacrocystitis is the inflammatory condition of the lacrimal duct and lacrimal gland. Ducts including gland. Dacrocystitis is actually inflammation of the lacrimal gland, and gradually, secondarily, lacrimal duct also affected. So it is pathologically Streptococcus staphylococcus infection. And the lacrimal sac is situated at just at inner canthus of the eyes. Inner canthus of the eyes, below the skin and nasal plate. In between nasal plate and skin and fatty layer, the lacrimal gland is situated. Lacrimal sac is situated. Lacrimal sac and lacrimal duct, they are connected with the sac. Upper lacrimal duct, lower lacrimal duct, they are formed at the sac, and sac is gradually downwards. Another drainage, that is the nasolacrimal duct. Nasolacrimal duct is connected with the meatus of the nasal bones, and it is drains the water which is constantly secretion from the lacrimal gland for moisturizing our eyes, and they are drainage to the lacrimal duct, lacrimal sac, and nasolacrimal duct to meatus. When lacrimal sac is affected, infected condition by Streptococcus, Staphylococcus bacteria, then the exudative fluid, mucus debris, and the lymphocyte cell is excited. These are form a pus-like appearance of this sac, and the sac is blocked. The sac is blocked. Then normal drainage is obstructed. Then watering from comes over the eyes. So this condition is called epiphora. This condition is called epiphora. Epiphora means the obstruction of the normal outflow, of the lacrimal discharge, that is the tearing. So epiphora is the common symptom of the lacrimal dacrocystitis. Now when pathologies go on, the swelling is formed, swelling of the lacrimal sac. Sometimes it is very painful swelling, like as a boils. A pyocele situation, pus formation inside of the sac, the pyocele situation is formed and very much painful. No drainage is there. Then we prescribe some medicine and some management. First one is the hot compress is required, hot washing is required, and very early stage when pain is there, severe pain with pus-like discharge, Hipersulf is the medicine. Now pus is there and no pain. Pus is there, obstruction is there, but no pain. Silesia may be indicated. Now very much obstructed condition, pain is there. So fluoric acid is very much indicated. Fluoric acid. Sometimes such swelling of the sac is burst out, like as a boils, and opening another drainage externally. So the internal lacrimal duct is connected with the sac, and sac is opening externally, another secondary opening. So lacrimal fistula is developed. Such condition is called lacrimal fistula. Then also indicated fluoric acid and silesia for lacrimal fistula. So dacrocystitis, if it is the acute, the Hipersulf is a good indicated medicine, is acute dacrocystitis. When it is a chronic, either painless or painful, in case of painless, silesia is most indicated, then fluoric acid is indicated. So three important medicine, Hipersulf, silesia, fluoric acid for dacrocystitis. Okay.
Yes, sir.
In case of lead,
yes, sir.
In case of lead, very common symptom, that is the stry and chalazion.
Yes,
we know everyone we prescribe for the stry and chalazion. Stry simply controlled like as the boils, belladonna, Hipersulf, pulsatilla. If chalazion is there, so there is a fine difference in case of stry and chalazion. Stry, actually the inflammation at the follicles of the eyelash is called stry. Inflammation at the follicles of the eyelash is called stry. But inflammation at the meibomian gland of the eyelids is called chalazion. So stry always at the lid margin, but chalazion always away from the lid margin. There is a basic difference, stry and chalazion. So stry is the always acute inflammatory condition. So pain, swelling, redness, very much swelling is there. But chalazion is called subacute inflammation. So severe swelling, pain like stry is never found in case of chalazion. So chalazion is slightly painful or swelling, but always away from the margin of the eyelid. So it is a chalazion, and sti is the at the lid margin, always situated at the lid margin, either upper lid or lower lid or both lid or both eyes, whatever may be. At a time one or multiple maybe, like this chalazion also. So a sti simply controlled by hypersal is always prescribed lower potency, hypersal 6. Hypersal C easily controlled. Sometimes apis mellifica may be required if cold water application relieve the patient. Patient says that the cold water application relieve the condition. So apis mel 6. Apis mel is very much important if cold water relieve the patient. Now, if cold water aggravates the case, so always hypersal. Always hypersal 6. Very much swelling, redness, but no pus is there. Swelling, redness is predominant. You may prescribe belladonna. You may prescribe belladonna. Now, in case of chalazion, pulsatilla is very important medicine. Pulsatilla, Staphysagrea, and Thuja. Pulsatilla, Staphysagrea, and Thuja. Pulsatilla, Staphysagrea followed by pulsatilla. Pulsatilla followed by Staphysagrea. And Thuja after Staphysagrea. Thuja after Staphysagrea. So after staph is the very important for chalazion when pulsatilla is failed. When recurrent history is there, so we prescribe Staphysagrea in case of recurrent history of chalazion. Sometimes we prescribe Thuja when Staphysagrea is failed. When Staphysagrea is failed, we prescribe Thuja in case of chronic chalazion. Now here it is my very much experience. One of the case suffering from multiple chalazion in both eyes and both lids. And all indicated medicine like pulsatilla, Staphysagrea is failed. Then I take the cases, total case taking. Why our indicated medicine is failed? Local symptom is indicated Staphysagrea. Local symptom is indicated pulsatilla. But why it is failed? So total case taking. Now it is case of the tuberculosis. That is a tubercular indication. So tuberculinum is the medicine, and I prescribe tuberculinum, but it is failed. Total case taking indicated tuberculinum. I prescribe tuberculinum 200, but no change is there. Tuberculinum 1M, but no change is there. So very astonished. Why such indicated medicine failed? So another knowledge is click in my head, brain. I read the case from Boric Mathematica. If such cases purely indicated tuberculinum, if there is any anti-miasmatic block like a psychosis, you should prescribe Thuja first, then tuberculinum. So in that case, it is the observation of the Barnett, Dr. Barnett observation we found from our Mathematica, Boric Mathematica. If the case is tubercular, but antipsychotic psychotic blockage is there, you should prescribe first Thuja, then tuberculinum. It is the observation of Barnett, Dr. Barnett. Dr. Barnett is a good clinician and so many work from tuberculinum. So I prescribe this patient tuberculinum after 15 days, Thuja 1M after 15 days tuberculinum. Next 15 days, after 15 days, Thuja 1M. Next after 15 days, tuberculinum. In this circle, 3 times tuberculinum and 3 times Thuja occidentalis, the case is totally cured within 3 months, 3 and 4 months, within 3 to 4 months. So totally multiple challenges. Very much important point. If any indicated medicine fails such that cases, you should prescribe Thuja, then indicated medicine. Maybe tuberculinum, maybe Staphysagrea, but Thuja is required. It is our experience.
Sir, also that it's a very good insight, sir. Thank you so much for sharing. Sir, also we would like to know what is our scope in cases of squint, because also we see a lot of cases of squint in our chambers. So
yes,
can we really help in squint?
Yes. In case of squint, first thing is squint is a two broad heading. One is the congenital squint, yes. Another is the acquired squint.
Yes.
Now, clinically, first we identify the cases, squint, and how much degree of the squint.
Okay.
It is the instrumental calculation, how much degree of the squint. And squint has a clinically defined name. If the eyeball is deviated laterally, or eyeball is deviated medially, or something, or eyeball is deviated upwardly. So deviation from his central zone. If eyeball we calculate, that is the two axis. One is the 180 degree, another is the 90 degree.
90 degree.
So this is the central point. The eyeball is situated at centrally. And centrally the eyeball controlled by our extrinsic muscles. That is the 6 extrinsic muscles of our eyeball. That is the 4 rectus muscles and 2 oblique muscles we know from our anatomy knowledge. And such extrinsic muscle controlled by 6 cranial nerve, 4th cranial nerve, and 3rd cranial nerve. 6 cranial nerve, that is the 6th cranial nerve, 4th cranial nerve, and 3rd cranial nerve. So such cranial nerve control our movement of the eyeball. Movement, either it is medial movement, lateral movement, upward movement, or upward movement, or rotational movement, whatever may be. Such control by 6 extrinsic muscle and 3 cranial nerve. Now, any problem, any lesion, any disease condition, anatomically and congenitally, of such extrinsic muscles, either their attachment is wrong, epineuritic position is wrong, or the nerve attachment is wrong, or such nerve is not work properly. This is the congenital disorder. Now, the medial deviation or lateral deviation, that is the convergent and divergent. Name is the convergent squint, divergent squint. Medially the eyeball is deviated, it is a convergent squint. Outwardly deviation, it is a divergent squint. So either convergent or divergent, we externally assess the case how many degree of this squint. Instrumentally it is a 15 degree, 20 degree, more than 40 degree, more than 30 degree. Instrumentally it is calculated. But externally we observe the patient, we examine the patient. One eye is blocked by one hand. One eye is blocked by one hand. Another hand, a torch light is focus of the opening eyes, and ask the patient, looks the torch light and central zone. We focus the light at central zone. So one eyeball is blocked, one hand, and another eyeball is fixed at the central zone of the light. Now suddenly we remove the block. Suddenly we remove the block. Then we look, the eyeball is deviated either externally or medially. The blocked eyes observed. This eyes is fixed and blocked eyes is observed. If deviation is maximum medially or deviation maximum outwardly. So it is the maximum deviation means more than 20, more than 30. And slightly deviation, maybe 15 degree or less than 15 degree. So by this way, we calculate it is the degree of the deviation. Degree of the deviation. Then congenitally or acquired. If it is the congenitally, then another examination by torchlight. We focus the torchlight and ask the patient, looks the light, not move the head. Looks the light, not move the head. So outwardly, upwardly, laterally, downwardly. By this way, we observe the movement of the eyeball. Which movement is restricted? Outwardly movement is restricted, inward movement is restricted, or upward movement is restricted, or downward movement is restricted. Which movement is restricted and how much? Restriction is the what level. If is the maximum deviation and maximum restriction, so it is not cured by medicine. Maximum deviation, maximum restriction, so it is not cured by medicine. It is required surgery. It is required surgery. Now minimum deviation, minimum restriction, it may be cured by medicine, our homeopathic medicine. So in such a cases, if it is the case of minimum deviation and minimum degree, then we prescribe Ectia racemosa, and Gelsemium, even phosphorus, Ectia racemosa, Gelsemium, phosphorus, for minimum restriction, minimum deviation, and Ruta. Another important medicine is the Ruta. Very good medicine is the Ruta. Now, if it is awkward, sometimes patient says, mother says, father says, my child is normal from birth, now 7 years says, gradually the eye is deviated. In born he is normal, now gradually deviated. So it is awkward. In that cases, we always think the baby suffering, the children suffering from worm infestation. Very good indication in worm infestation can causes squint develop of the patient. So first thing, ask the patient, you took the anti-worm medicine. In homeopathically, Sina, Spigelia, Santonin. Three important medicine to control the squint if the cases is worm infestation. It is awkward condition. Sometimes paralytic origin may be squint formation, cold exposure, the eyeball is gradually paralyzed on the left sided or right sided. Such paralytic origin due to cold exposure, we prescribe Gelsemium. Sometimes causticum also indicated if it is awkward due to cold exposure, paralytic origin. Any motor paralysis or muscular paralysis, then we prescribe causticum, Gelsemium. This is also graphite is sometimes indicated, but causticum, Gelsemium, most of the cases causticum, Gelsemium. Worm infestation, so Sina Spigelia is a very much prescription, all and often prescription. And if it is the congenital origin, maximum deviation, maximum restriction, to prescribe surgery. Minimum restriction, minimum deviation, so medicine is controlled. Okay. This is a very important cases of the screen.
Yes, sir.
And one of the another,
please, sir.
One of the important another point, that is the conjunctivitis, very common disease. Conjunctivitis, very common. All patients suffering in seasonal conjunctivitis or any other time of conjunctivitis, either it is bacterial or viral. But allergic conjunctivitis is very common in your chamber homeopathically.
Yes, sir.
So because allopathy has no medicine, anti-allergic drug and histamine tablet, and patient says the last 2 years we take so many tablet is there, but our allergy is not controlled. Any is not controlled. So such allergic conjunctivitis, any smoke, dust, cold, anything, any scented particles. The patient suffering from sneezing from nose and the watery discharge, itching of the eyes, this type of allergy. It is called allergic conjunctivitis with rhinitis. Allergic rhinitis with conjunctivitis. So condition is their allergy, either in associate with rhinitis or simply conjunctivitis. So it is a case of allergic conjunctivitis or allergic conjunctivitis with rhinitis, or patient sometimes respiratory distress also, some cold exposure, cough, respiratory distress. It is an advanced allergic situation. Now I say the cases is the allergic conjunctivitis. So very important medicine is there. Apis mellifica. Patient says itching, redness, lacrimation is there. Some 1 year's baby, 2 years baby, 3 years children, 4 years children, and sometimes adult. Go outside, come home, and itching start. Go outside, exposure, some atmospheric exposure, itching start. And says now cold water exposure. Cold water. Jotokkon patient, tills the patient apply cold water, patient gets relief. And when patient leave it, then itching start. So cold water relieve the cases is the Apis mellifica is one medicine is relieve the case. All cases when patient says it is relieved by cold application. So Apis mellifica is the cases. Apis mellifica is the case. If Apis mellifica 30 to 100, now not control maximum, not control maximum. Recurrence is there, but modality is the same. Then natamine. Then natamine, because natamine is the complementary chronic of the Apis, and it is also relieved by cold. So natamine is a good medicine followed by Apis mellifica. In cold application, if cold application aggravate the cases and patient take warm water, then it is relieved. Sometimes patient says the discharge of the air, that is also warm. This is also warm, and get to the eyes to gets relief. It is also warm warm air from mouth and gets relief. So in a word, that is relief by warm, by any means. It is relief by warm. So Rastrux is the medicine. Rastrux is the medicine. If it is the relief by warm, Rastrux is the medicine. Now patient says, severe itching, cannot relieve my hand and burning. Severe itching cannot relieve my hand and burning. So sulfur is indicated, sulfur 6 or sulfur 30, 1 or 2 dose. It is cured the cases. Sulfur 6 or sulfur 30. 6 is most important potency for that cases.
Sir, I was going to come to the same point, but a little bit in a different way. That when we all the junior students, all the beginners have, they keep prescribing or they keep seeing about Euphrasia eye drops and Cineraria eye drops. Are they really helpful, sir? Should we really use it? And if so, what should be the condition to use it? Because it becomes very generic to use it in all the conditions. Euphrasia eye drops, any eye companies just give Euphrasia eye drops to make them relief.
No, the 2 eye drops in our homeopathy. No, not many eye drops. 2 eye drops is the one is the Euphrasia, another is the Cinerea maritima. Cinerea maritima only for cataract. Cinerea maritima eye drop only for cataract. But precaution is there. 2 composition, one is the alcoholic, one is the non-alcoholic. Never prescribed alcoholic. Always prescribe Cinerea non-alcoholic drop, because alcohol has a action to absorb the water. Alcohol has an action to absorb the water. So alcoholic eye drop, if you apply the alcoholic eye drop, your eye becoming dry, becoming dry. So it is worst condition of the patient. So never use alcoholic. Always use water-based, non-alcoholic, Cinerea maritima in case of cataract. In case of acute conjunctivitis, either allergic or bacterial, you may prescribe Euphrasia eye drop. It is not curable. It is not curable eye drop, only for soothing effect, or some patient feels better, but internal medicine is always required. Bacterial conjunctivitis, Argentiniticum, Belladonna, Rastrux, Apis also by bacterial conjunctivitis. And ophthalmia neonatum is the another term. Newborn baby suffering from purulent type of bacterial conjunctivitis caused by Neisseria gonorrhoeae. Ophthalmia neonatum, this type of infection caused by Neisseria gonorrhoeae, not only simple organism. And such infection comes from accidentally or from birth canal if mother suffering from gonorrhea. Such patient suffering from ophthalmia neonatum. Such baby suffering from ophthalmia neonatum. Sometimes accidentally infection comes, mother is okay. But most of the patient, the mother are suffering from gonorrhea, the infection comes from birth canal. Now sometimes patient suffering from purulent type of discharge due to Staphylococcus infection. Argentiniticum is one of the important medicine. Belladonna, Apis mellifica, Rastrux, Pulsatilla, Calibi. They are also for bacterial conjunctivitis. And already says the allergic conjunctivitis. Sometimes Sometimes conjunctivitis due to some specific infection, like as patient has a tubercular focus or syphilitic focus their body, patient secondary infection comes there. So this type of infection, we always take the history, is any other infection, any other condition is there or not. So secondary chance always for conjunctivitis from secondary infection. So these are the important from our eyes, eye diseases.
I'll take a few more minutes of yours. I know we are done. We are very close to 1 hour. So just Dubois, what is the role of Duboisia? We read that even Duboisia has a lot of good eye symptoms. So what are the clinical conditions where we can use Duboisia?
Duboisia is indicated for conjunctivitis, but in our practice, very rare prescription for Duboisia. Yeah. Very rare. Okay?
Very rare.
Very rare prescription. But Duboisia is conjunctivitis or corneal ulceration, or sometimes that is the color disturbance. Color disturbance. Patient looks some peculiar color in front of the eyes. In front of the eyes, Duboisia is indicated. But for these cases, I say some medicine. If patient suffering from some optical illusion, that is the photopsia. Optical illusion or photopsia, any color in front of the vision, any color in front of the vision. Sometimes flickering of the light, like as a lightning, flickering of the light, flashing of the light. Sometimes green spot in front of the vision, red spot in front of the vision, white spot in front of the vision, black spot in front of the vision. So Duboisia is the medicine when patient suffering from such optical illusion. But rare prescription, I have very minimum prescription, but I get most result. Other medicine, like as a flashing of light, cyclamen is a good medicine. Cyclamen, flashing of light. Now patient suffering from gray object, that is the argentum nitigum, gray object. Now green object, that is the phosphorus, green object. Even blue object, patient suffering from red object, it is also phosphorus, green and red. If it is the blue object, then crotellus auridas, blue object. Yellow object, santonin. Okay. So this type of color defect, it is called color illusion, not color blindness. It is not color blindness. It is called color illusion. Color illusion. Some black point, some yellow point, some red point, green point is fluttering in front of our vision. It is called illusion of the light, illusion of the color. So these are the different medicine. Duboisia also for illusion, optical illusion.
And sir, while you were mentioning optic nerve, I'm just curious to know, sir, is there a role of homeopathy in optic nerve atrophy? Because we also see sometimes patients coming for optic nerve atrophy, that because they are seeing that there is no much hope anywhere else. But can we offer some help to them in cases of optic nerve atrophy?
Actually, optic nerve atrophy, it is a very lost case. Optic nerve atrophy. And patient when comes to a chamber, why optic nerve atrophy? Patient comes to a chamber totally lost, come here and there, so many allopath. For 10 years, last 10 years, they are going here and there, up to Vellore. So all complete, then comes to a chamber. There is no hope, so go to homeopathy. There is no hope, so go to homeopathy. It is a very danger and very difficult for us. When all hope is lost, all nerve is damaged, how I activate it? So if there is any chance is there, first thing, why it is lost? Why it is lost? Very important. Sometimes patient comes to a chamber with optic nerve atrophy, the adult cases. They are taking so many addiction, like as alcohol, like as a tobacco, like as a ganja, charas. This type of addiction, this addiction, a bad effect of such addiction may lose the optic nerve and becoming atrophy, loss of their function of the optic nerve. If it is the case of the alcoholic, nux vomica, higher potency, always 1M. Alcoholic, tobacco effect, tabacum, 1M or 10M, nux vomica, tabacum and phosphorus for optic nerve atrophy. If any addiction is there, Now another important for atrophy of the optic nerve, one important disease, congenital disease, that is called amblyopia. Amblyopia means partially loss of vision, partially loss of function of the optic nerve inborn. If within 8 years of the age of the patient, it is treated, it is curable. And the optic nerve may be activated. Now patient comes to a chamber at the age of 30, 35, 25 with optic nerve atrophy. And with the history is there, patient says, I cannot know, my right eye is totally damaged, but my left eye is fully activated. I can see all things in my left eye. And never patient observe the right eye is totally damaged. Gradually, the optic nerve is damaged. But inborn patients partially lost his vision by optic nerve, inborn. But patient does not know. When patient know at the age of 25, the scope is out my hand. Scope is lost. Because up to the age of 8 years, it is curable. After that, it is non-curable. So when comes at the age of 25, 35, 30, your prescription for such optic nerve atrophy, if the history is the amblyopia in the early age, then it is a Ruta 200 1M, Ruta 200 or 1M. In addition to, that is the multivitamin therapy, especially vitamin A. Okay. In addition to multivitamin therapy, in a vitamin A is more amount, such amount, such medicine is there where the vitamin A is more, like as a trade name, glow eye tablet. A trade name is there, glow eye tablet. Enrich vitamin A. Enrich vitamin A. So it is helpful to activate the optic nerve, not up to the mark, but to some extent, patient sees something. It is my observation, but in my experience, patient can see by this way of treatment, the light, I can observe the light. This is the window, this is the door, and this is the light, tube light, here it is the fan. This observation comes return after this type of treatment, Ruta and multivitamin therapy, like as a enriched vitamin A therapy. It is my observation, it is my experience.
And sir, you were saying that in first 8 years is very vital in such cases. So is there a change of remedy in first 8 years where we can really aggressively treat it and get it better earlier?
In what cases?
You said in first 8 years it is very important to treat.
Yes, in case of amblyopia.
So are there any special remedies which we should consider in the first 8 years of the patient's life?
Yes, when patient comes within 8 years, so here it is in case of amblyopia, here it is also Ruta, then Ruta lower potency 6 and 30. And multivitamin always required. And Ruta is the important medicine. Now, inborn congenital disorder generally depend on tubercular cases. So tuberculinum we prescribe in case of congenital cases, or sometimes syphilinum. But tuberculinum, syphilinum is a congenital medicine. But nowadays, maximum vaccination is there. So patient suffering from some antipsychotic condition, so puja may be indicated. But tuberculinum,
I think, sir, we are losing your connection, sir. We are losing your internet. Maybe there is some fluctuation in internet. Is it my internet or is it sir's internet? Can somebody write in the chat box? Are you able to hear me all?
Yes, some internet connection disturbed.
Yeah. So I'm just confirming. Hello everyone. Am I audible? Is sir audible? can everybody just mention in the chat box?
ইন্টারনেট কানেকশনটা ডিস্টার্ব করছে বুঝছেন
ইন্টারনেট তো ঠিকই আছে নেটের প্রবলেম
No, I think it should
90%
get better.
says
It should get better. Just few seconds, and I think it will get better, sir. Sometimes it is fluctuating. So you all saw, sir has such profound knowledge about ophthalmology. Sir has such vast experience on all the different clinical conditions that he highlighted. I know there is so many things that we want to learn, that we want to understand, and there is a long list of clinical conditions which everybody is mentioning in the crowd, mentioning in the chat box, but unfortunately we are not able to cover everything. We will try and request sir again, because we have had his 1 hour 15 minutes already, and I really respect his time because he's a busy practitioner, and if we keep on going, we can go on for 3 hours. There will be no, and there is no end to learning from sir. But sir, I'm very thankful to you that you spared your important 90 minutes to us so it was really helpful. And I'll also thank your student and my friend Maruf, who was coordinating throughout, and I was constantly troubling him every week कि sir का date कब मिलेगा, sir का date कब मिलेगा. And thank you Maruf for being so helpful. And sir, we cannot imagine, you cannot imagine what amount of happiness we all are in by merely attending. And not there were approximately 70-80 students who were constantly there in the session, and more number of people will learn when we will post it on internet. So we will always request that if there becomes a time when we will request you for one more session, and we'll be very glad to have you once again. But sir, thank you is a very small word to express our gratitude. I'd like everybody to just mention in the chat box how happy you are, so that sir can read, and sir will, because there is some internet lag, so maybe if you can write it in the chat, sir is reading it, and sir will also be able to know that you all are very happy. It's not just me that he is happy, and expressing my gratitude to sir.
Thank you. Thank you to all.
Yes, sir. So thank you so much for today, and I'm really very glad that you came, and we will look forward to see you either personally in Calcutta, or maybe once again on this Instagram live session.
Can you repeat again?
Please repeat again. I cannot stand.
Yeah, sir. I'm saying I'm really very glad. I'm very thankful that we could all hear you, and we will look forward to more sessions in future if you have time, or I will come personally to Calcutta to meet you in Calcutta Homoeopathic Medical College.
Okay.
Well, I'll be glad to meet you. I'll be happy to meet you.
I will happy to meet you.
Okay. Thank you, sir. Take care. Bye bye.
Thank you.
Have a good day, sir. Thank you once again.
Thank you.